When I got and I took the level one, my mission, as Bruno said, we don't teach classes, CrossFit classes. We can't do these things here in Brazil. So I think that our mission is to demystify what CrossFit is.
Hello, and welcome to Pursuing Health. I'm Dr. Julie Fouché, family physician and former CrossFit Games athlete. Here, I bring you information and inspiration to help bridge the gap between fitness and medicine and support your journey toward your healthiest self. This episode is a conversation that I shared with two doctors from Brazil, Dr. Rodrigo Jasbick and Dr. Bruno Cardoso. Rodrigo is a clinical cardiologist and intensive care unit chief medical officer, and Bruno is a doctor of sports medicine and a regular member of the CrossFit Games Medical Team. Each of them experienced paradigm-shifting personal experiences through CrossFit that have motivated them to team up to educate their colleagues and patients on the power of the CrossFit methodology. It's always inspiring to meet people whose lives have been changed by CrossFit, but to hear Bruno and Rodrigo's stories and how they're now using their own experience to transform their communities and their profession is especially powerful to me. I hope you enjoy what they've talked about as well. Before we dive into the episode, I do want to make it clear that this podcast is for general information only and does not provide medical advice. I recommend that you seek assistance from your personal physician for any health conditions or concerns. So with that, let's get to the episode. Welcome to Pursuing Health. I'm really excited to be here today with two doctors, Rodrigo Jasbick and Bruno Cardoso from Brazil. And I am so excited to hear about your stories. We've seen your enthusiasm for CrossFit and how you are spreading that across your country and to other doctors and the general public. And so I'm excited to dive into that today. So thank you for taking time out of both of your busy schedules to speak with me. So I thought we could just start at the beginning and how each of you found CrossFit to begin with. What was your background before, and then how did you come across it?
Yeah. Can I start, Bruno?
Yeah. Please.
So, as Bruno said before, Julie, first of all, I would like to thank you to invite us to participate here in your podcast. For me, it's an honor to be here. I said you before that you are my idol in CrossFit sports. And for me, it's amazing, very, very exciting to be here. And I would first, sorry with our people that are listening, we are listening us now, because I don't have my English so fluent as Bruno has, and he will help me sometimes here when the words get out of my mind. He will help me to make myself understood. I would like to introduce myself. As you said, my name is Rodrigo Jasbick. I'm 44 years old, and next year I will be celebrating 20 years that I become doctor. Wow. And a cardiologist. But I'm very happy with that date next year. And nowadays, I am the head of ICU in Hospital Clínica do Esporte here in Goiânia. It's a big hospital. And as cardiologist, I am the technical director of Clínica. So in the mornings, I work with heading an ICU. And in the afternoon, in my medical office as a cardiologist. And I started CrossFit in it was in 2017, when I was looking for something that could give me strength to be better in marathon. I was a marathon runner, and my wife practiced CrossFit at that time, and I didn't know what CrossFit was. And she invited me every weekend to go there with her. But as many doctors as I know here in Brazil, it has a prejudice that CrossFit hurts, that CrossFit is dangerous, that CrossFit is only for athletes or strange people. And I thought, like many doctors think nowadays. But I went with her to stay her side, and I felt in love with the methodology and the training that I truly believe that has changed my life as a person and as a doctor. After I took the level one MD, I think this was the thing, the what happened that make myself change as a doctor and the people and as a person. On that time, I had high blood pressures. My cholesterol levels was higher, and glucose either. And as we are teach in medical school, we get people sick and give medicine, pills medicine, make the diagnosis, treat with medicine, and put people, get them sick and put their health. But they not health. They are taking medicine. And unfortunately, medical school teach us to stop here. And when I was studying for the level one course, the page 21 changed my life. That I have this page in my office where I show to my patients where they are and where they can be. So this page changed my life, and it was the continuous of health where we get people sick, put in health, or we can make them well conditional. This thing to make people health to well conditional, where we can protect people against the chronic disease, wasn't medical school that told me, was CrossFit. And I am very thankful for that because I started to do it with myself. And later, and nowadays, I do it with my patients in my medicine office. So I started that profile in Instagram that I thought that, as I told you, doctors here, most of them uh, say fake news, very uh, say some say things that are wrong about CrossFit and lies of CrossFit. And I think that my mission and our mission as a doctor with level one is to demystify that, defend across about these lies that are saying. And we as doctor, we have this authority to fight against it. And I thought that we use the Instagram, like Bruno said, your doctor does CrossFit here in Brazil, seu médico faz CrossFit, it has an impact that people say, well, but all doctors says that we can't do CrossFit. But now we have one doctor and many other doctors says that CrossFit is good, is life. What is happening? Just this thing make people curiosity to hear what we say. And me, Bruno, and the other doctors, we don't say just what we think. We bring to the community lectures, scientific studies that allow the CrossFit and the high intensity training that it's good for health. And the medical of all of this is this we see every day it happens in our CrossFit boxes with many people, and this medical, this community, and the good things that we can share with these people. I believe that it's what make it a little bit famous my profit, my profile, my in Instagram. And I'm very thankful to CrossFit because of that. We don't have, me and Bruno, we don't have any professional contact with CrossFit. We don't have any contract. We do it because we love, because we truly believe that it can make changes in our patients' lives, in our friends' lives, and in our lives. And I do it with passion because I truly believe it saved my life. So I can save other people because I saved my life. And we have a friend here in Brazil that she said that a doctor that don't change his behavior, he don't have authority to change the others. So I truly believe in these things. And this is my story. I love the CrossFit. I am the only cardiologist with level 1 in all Latin America. It's good for myself. I feel good with this, but alone I can't do anything. My wish with CrossFit is if we could spread this message to many other doctors, many other cardiologists, and we are working for that. This is my little story with CrossFit.
That is
I
amazing.
I hope that I could speak just good to you to understand
That was
also with
perfect.
my poor English here.
You have great
Sorry.
English. That was perfect. And I
Uh,
love that your
uh,
wife was the one who got you into it. I didn't know that. So
yeah,
you
she
have her
saved
to
my
thank.
life. Yeah.
That's amazing. And so amazing just hearing your own story, how you were already doing a lot of exercise. You were already running marathons, but yet you had some high blood pressure and high cholesterol and were on medications. And like you said, maybe not going down the best path for your health. And that sickness, wellness, fitness continuum, I agree with you. When I first saw that drawn up on the whiteboard at my level 1, when I did it, I think it was Pat Sherwood, and that changed my life.
Yeah.
And it's amazing how just that shift in your perspective changes how you think about all of medicine and your patients and how you can give them the best care, and seeing that ripple from, you know, helping you with your own health, but then how that ripples into, like you said, your patients, your family, your friends, and other doctors, so that they can impact people too. So incredible. How about you, Bruno?
Julie, first of all, it's an honor to be here, talk to you and sharing our story. It's really important for us in Brazil to be seen as a part of CrossFit history. We are one of the largest countries with the most affiliates right now, and it's really an honor for us here. So my first contact with CrossFit was in 2014. So I've been doing CrossFit for the past 7 years, and I finished my residency in sports medicine in 2012. And by then, I didn't have any contact or any information about what CrossFit or high intensity functional training was. Even though I was with elite sports, I was in 2012 the head physician of the Brazilian men's basketball team. And our training program was just a regular conditioning for basketball. Wasn't any functional movement that we could apply to the general population. By then, the only available interventions were regular workout in gyms and running and some sports, but not a training program or conditioning program that really could affect some health markers effectively. So in 2014, I really got interested in CrossFit. I dropped in an affiliate with my current girlfriend, which now is my wife. And at that time, my mother-in-law also, her mother also joined CrossFit. And different from Rodrigo, that had a personal history, my history with first patient contact with CrossFit was her case. She had a severe hip problem with a chondropathy in her hip, but she was already followed by a personal trainer, a physician specialized in rehabbing, and they were both prohibiting her from deep squatting because of her hip problem. So it's a very common issue that we see all the time. So if you have a hip problem, you should not go deep squat because it's gonna get you more injured. And now we see that it's going to strengthen even more your posterior chain muscles, your adductors, get full range of motion. It's much better for for rehabilitation. And since she was 52 at the time, 50 at the time, since she started CrossFit, I could see all day her improvements just by encouraging her to gain better strength, gain better full range of motion, and she no longer has any issues. So I was seeing that a very powerful weapon to treat my patient at my clinic. I have a clinic with multidisciplinary clinic in my city here in Florianópolis in Brazil, where I have some dietitians, we have physiotherapists, we have sports psychologists. And since then, we could present CrossFit for all of them. So basically everyone in our clinic has some history with CrossFit. They've been tried CrossFit, some of them been practicing CrossFit. And even if they don't practice anymore, but they know how to deal with all the CrossFit challenges that getting from a different sport to a CrossFit gym. And we can help our patients the better way to make it more long life lifestyle.
That's
so
amazing.
in 2000, so in
Question about
2015,
that. When you said most of your patients have some experience with CrossFit, do you refer them to local CrossFit affiliates, or do you have some relationship with coaches or trainers that you refer your patients to?
Yeah, because I was one of the first physicians in the city to do CrossFit and to have some experience. I got some exposure in CrossFit because in 2016 I started going to the medical team at the CrossFit Games. Mm-hmm. I had my first experience at the former regionals that we had, the Meridian regionals in Madrid, and on the same year I went to Carson for the first experience. So by then, basically a lot of the coaches in the area in the country, they could get to know that we had a Brazilian doctor really involved in CrossFit and talking about CrossFit. So they had someone at the physician side by their side. Mm-hmm. So they could refer patients or basically some CrossFit clients to my office. No, you should see Bruno because he has some knowledge of CrossFit. Mm-hmm. And he's going to help you just like along with the coaches with the best strategies to make the best adaptations to some pain issues or preventing some injuries in CrossFit. We know just like other sports, we have a low rate of injury per hour, per 1,000 hours comparing to other sports, but still there are some. Mm-hmm. There are some spots that we should care. And sometimes accidents happens, and so you should finally see a doctor that tells you, oh, it's okay, let's face it, let's deal with it. But it's not the CrossFit the problem. It's the way like they all been doing the years, the decades before going to CrossFit that didn't allow your body to be yet ready for that sport. Mm-hmm. So that's why I get a good relationship with all the coaches and the affiliates. And by doing some medical care with all athletes at the games and all the locals competitions, and I could get more experience on that. So 3 years ago, we started our own affiliate here in the city, which my wife now runs. And we have the whole family doing CrossFit. Even my daughter, she's 3 years old and she does the CrossFit Kids. So she's been doing CrossFit since she was born. Until the 36 weeks of pregnancy, my wife was doing CrossFit. So she was doing erg ski, she was doing kettlebells, she was doing lunges, she was doing all kinds of sport, and she had like the most soft and smooth labor pregnancy that she had ever done. So we have a lot of experience in that, and I'm very grateful.
She had some improvement from CrossFit too when she first started, right? She was. Yes. It had a big impact on her health.
Yeah. She was. My wife used to have some pain issues, like all the body, basically anxiety related and fibromyalgia, anxiety. And now she does CrossFit like basically 6 times a week, and she's free of any anxiety medications, because of that, like pregabalin or gabapentin or other pain effects, and so she no longer needs any effects because she doesn't have any behavior issue, or even the pain thresholds have increased a lot.
That's amazing.
So that's a very nice unexplored area of CrossFit. Maybe we should work with some more psychiatrists.
Yes, we know for fibromyalgia, exercise is one of the best treatments, and I've had other patients, or not patients, I guess, other people on the podcast who've had great results from doing CrossFit on their fibromyalgia symptoms. So that's amazing.
Yeah.
And amazing that you've taken it in as a whole family and now are having the affiliate and your daughter doing it too.
Yeah, it's awesome. You see, like my daughter watching her grandfather with 62 doing some squat snatches, doing some handstand push-ups, double unders. It's nothing better than an example at home. She's 3 watching her grandmother with 58 right now doing some legless rope climbs. It's amazing.
Oh, wow. That's impressive.
Yeah.
Now, how did the two of you meet?
I guess we first met. I got an honor to be invited to be on the first medical doctor level 1. I guess you were there also, Julie.
Oh, so that's when you both first met?
At the ranch. No, I was invited to go there because by then I had a close contact with Greg and Karen at the games, and they let me know that they were holding the first medical level 1, and so I got the opportunity to bring that medical level 1 to Brazil. And I was in charge of making 2 classes, one in Rio and one in São Paulo. And along with Ricardinho, we put it together, and we got about 20 to 30 doctors in each city from all over part of Brazil. That's where Rodrigo and his wife got the opportunity, and they demonstrated interest in becoming a level 1. So we met in São Paulo. That's where our first contact was. And since then, I was the medical team, the team lead for the Brazilian CrossFit Championship, which they take the sanctional that we have here. And I got the pleasure to have Rodrigo on my team as well.
Yeah. That's awesome.
In 2018, the regionals of CrossFit was here in Brazil, and Bruno was there. And in Rio, Greg invited the doctors to a dinner. And Ricardinho, I do CrossFit here in Punk, CrossFit with Ricardinho. And he invited me and my wife to, if we went to Rio, to participate that dinner for all doctors that practice CrossFit. But she had a surgery in her nose, and I couldn't go to Rio on that time. But Ricardinho said to me, we have now doctors that may doing level 1. If you want, say me that I can help you to do that. And I found in the Facebook a page that Karen manager this page. She take care of this page, and I sent a message to her, and she answered me. It was fantastic. It was to be done. She asked me if I would like to stay in São Paulo to do the level 1, the doctors of level 1. So I sent a message to Bruno, and was there that we meet each other. And since then we are working together. We close together. And I am very thankful to him to open the door for me in CrossFit Level 1, in medical team, in BCC. And we are friends now.
Great. That's
Because
great.
Julie, we have this aspect here in Brazil, different from the United States. Even if you're a physician with a level 1, you cannot teach classes. If you're not going to the university on physical education, you're not allowed to teach anything in sports relation.
Wow.
So, like our currency in reais is very different from the American dollar as well. So it gets kind of pricey for a regular physician in Brazil to make the level 1 course just for the knowledge. If you're not going to get any profit from teaching someone and getting financial return on it. So it was a really hallmark in the country to provide by that time. It was a gift from the CrossFit Health by then. So they didn't have any cost. So from one day to another, we had like 2 doctors in Brazil that had the level 1. Myself and a friend of mine that went to the range as well. He's one of my partners at my clinic. He's orthopedics. From one day to another, we had over 50 doctors spread from all over the country, sharing the same information about CrossFit, getting more knowledge on that. A few of them were not involved in CrossFit at all before the level 1. Some of them were doing CrossFit for a few years by then, but it was a very nice jump start, to spreading more of that. And since then, we know how Instagram and social media has evolved. So I follow pretty much all of them that were there by then, so became friends. We know how much their impact they're causing on their communities and their cities and nearby. Some place that myself alone, of course, we couldn't reach, So it was very important for us that time.
It's amazing. Yeah. Just like you both sort of referenced how powerful that level 1 is, just being able to learn the methodology and the reason behind why we do what we do. It really helps, I think, empower anyone, but especially a doctor who's seeing patients, to maybe not be afraid of CrossFit anymore and understand how it can be actually helpful for creating health. And you all, after bringing that to Brazil and being able to educate more doctors, you also have continued to really try to educate and break down those barriers. It sounds like maybe even more so than in the US, it seems like a lot of negative perceptions of CrossFit, or a lot of fear that it might be dangerous. But can you talk about what you've done in terms of educating doctors in Brazil, through your Zoom calls and being able to network them and get them together?
Rodrigo's been doing a few speeches on a few places around the country. You can talk a little bit more about that, Rodrigo.
Yeah, we have me and Bruno. We create a group with those doctors who had the level 1. And it's increased a lot. We have more than 100 doctors in this group now. And we share knowledge and discuss lectures about CrossFit and health. One of them, we had the honor that you stayed, you was with us, remember?
Yes, that was great.
And we started doing this process to spread the message of CrossFit to doctors in a group and in WhatsApp, and later in Zoom with all of them. From the middle of this year, we stopped to do that because we are very busy, everybody, because the pandemic. But next year, I believe that we will come together again in that meeting that we did about 3 months. And later this year, I was invited in many camps and boxes that they asked me if I could stay there and speak about CrossFit to the community, to coaches, and other health professionals. And for me, it was a pleasure, is a pleasure to be a kind of a reference, a doctor of reference about CrossFit with Bruno. And I went to these camps and box to spread. But something I asked Karen before. I talked to her if she to make her know what we were doing here, and she allowed. And she is the one of the best person I knew in CrossFit that give us this support because nowadays we don't have any kind of relationship, official relationship with CrossFit. We are level one, and I think that as a doctor, as a doctor, we can make these messages with more authority. Here in Brazil, when a doctor says, normally he has the final words. If he says that one patient or one person can't do CrossFit, it's very difficult to change these things this way. But when a doctor says that CrossFit is life, that CrossFit can be done for everyone, it has the same impact. So I study a lot. I learn about and search from many lectures, scientific studies that allowed do CrossFit with safety and security. And this year I traveled a lot from all of Brazil to spread this message. And I'm very happy to do that. And I think that next year I will continue to do that. I do, as I said to you, I do it because I love, and I truly believe in it. And I wish one of my wishes with CrossFit is that CrossFit see what we are doing here and support us with officially. And we were very excited with CrossFit Precision Care. We are very how can I say very excited to what is coming up here. And but we know that it will be a process that won't came to Brazil as soon as we want.
Right.
And until it comes to here in Brazil, we are working with what we do in social media and presenting in competitions, in camps, in the boxes, and say to our community that CrossFit is a good thing to be used to get health. And I'm very happy to do this work here with Ricardinho, with Bruno, and we will stay doing it until I don't know where.
Yeah, and it's such important work, like you said, just being able to spread that message and open people's eyes and expose them to the power of CrossFit. Like you said, it's life changing when you think about all the people you impact and the patients that you impact. And I know with your Rodrigo, you have the Instagram that we've mentioned a few times, and how it is very powerful for a doctor to say, to recommend CrossFit or to say that it's okay to do. Can you talk a little bit about that and maybe the medical culture in Brazil and how your message has been received, maybe some of the pushback that you've experienced as well?
Yeah, it has, as I said, it has an impact when someone see a doctor speaking that CrossFit can be done for everyone. People who don't know CrossFit think that CrossFit is something that is only for athletes, strange people that do only complex gymnastic movements. and that how can someone who is obesity, diabetes, has high blood pressure, can do that movement and have barbells that we push every day. So my what I think, and I have to me, that when I got took the level one, my mission, as Bruno said, we don't teach classes, CrossFit classes. We can't do these things here in Brazil. So I think that our mission is to demystify what CrossFit is. And in social media, it has a big impact. And I did, I started that profile about 4 years ago, if I remember. And as Bruno said, many people goes there to attack myself because it's what you said. It's changing how people think about this methodology of training. And I live with the both sides of this question. It's very good. I see every day people send message to me asking if they can do something because they have a cardiological disease. They are with obesity, some or any disease, and they asked me because they said if I go to my doctor, he will say that I can't do CrossFit, and what I just say, and it's one of my favorite speech, as if he said that these things change the doctor. I always say that change the doctor, and with my authority as a doctor, I can say that. And all coaches, other professional health, they are stay happy. They are happy with. They have some doctors that allowed this methodology, and simply I said to them, change the doctor. If he say, if a doctor say to you that you can't do any movement, how do you go to your work to work? How you take care of your kids if you can't do any functional movement? I don't believe in it. But what I see is that doctors don't know what CrossFit is. They don't know how can it impact and improve our lives. And just about to, they only don't know. They said that it can't be done because they think that it's for only for athletes. Because of this fact, I believe that level one for doctor is amazing tool that CrossFit has in their hand, having their hands, because we need to teach and change this point of view of doctors, and only give the message to them. It was what happened to me with Bruno and many other 100 doctors that has level one here in Brazil. It's difficult to say to a doctor that don't know CrossFit that say that it's very good, it improve life. And I think that because of that, my profile on Instagram make this is a little bit successful because I try to give the to community and any people lectures, scientific publications, my point of view, and as a level one doctor that can everybody, of course, with the scaling that it's necessary to each person, but everyone can do CrossFit, and it's good and improve health to everyone. It's what I believe, it's what I share and spread in that profile in Instagram.
Great. So you mentioned some obstacles to having, helping more people understand CrossFit and do CrossFit for their health. One being that doctors maybe are afraid of it. Another one being maybe perceptions about CrossFit being only for competition or only for people who are already very athletic. Bruno, do you know of any other big obstacles, or are those sort of the main two that you feel like you're running into in Brazil?
Yeah. Our medical education in Brazil, it lacks a lot of information about exercise in general. We spent 6 years
in the US also.
Yeah. We spent 6 years in college, in medical school, learning how important exercise is for modifying lifestyle changes, for improving cardiometabolic diseases and preventing cerebral degenerative disease. But we never learned how to do it. We never really learned at the university what's the real importance and the impacts on cardiovascular training, different from strength training, different from endurance training, balance training. So we don't learn it all. So we grow and we become doctors with some concepts that were built just like any other profession. But we are in a position to make big recommendations, and they have a very large impact on our patients' behavior. So we see, even on on the sports medicine residency and postgraduates in sports medicine, we still need more information about high-intensity interval training, even if it's CrossFit or no. The benefits and the differences in physiological and how it impacts on diseases doing high-intensity interval training with functional training, with full range of motion, of course, with all the stages, scaling and adapting until you reach the proper positions of that. So the obstacles is dealing with our physicians and doctors' egos by saying, oh, I've never studied like that, so you should seek some other specialty. Even though I have a lot of referrals from physiotherapists, physical educators, coaches from CrossFit, I don't have referrals from other doctors. I don't get patients from oncologists. I don't get patients from pneumologists, from endocrinologists. That I know they never had neither the specialty from sports medicine or the courses or the studies made from a level 1 course, for example, regarding a patient that does CrossFit. They don't refer it. So even though I'm a doctor, I'm an endocrinologist, I can take care of your diabetes, but I don't have enough knowledge on CrossFit, but I should refer to a doctor that does. So it's a very big obstacles because some patients, they get stuck on the same model of treatment. And if they don't by themselves decide to change, it takes so much time to be done. I don't know if you get that as well.
Oh, absolutely. I think that the education on multiple levels and how medicine itself has become very siloed in different specialties. And so thinking about, let's look at the big picture of what are those underlying causes of disease, which are often rooted in our lifestyle. And, we mentioned briefly the pandemic, and that also seems like a big opportunity all over the world for us to reshift our focus to how can we help people be as healthy as possible? How can we help them be more resilient, whether they end up having COVID or any other type of condition. And I think a lot of people, myself included, have been frustrated by that missed opportunity to put that focus back on, how can we create health? How has it been in Brazil? Have you seen any increased focus there on things like exercise and sleep and nutrition, or has it been just really focused on?
No, we get so much frustration as well, because we see We know that COVID, we don't deny it was a pandemic that really affected everyone, but we do know that people had the best fitness level. It could be done by CrossFit or any other sports made in, if you have like enough strength, if you have cardio, if you have cardiometabolic markers under control, if you have a proper nutrition, stress management. And we know how important CrossFit would be for that, but we don't see the media, we don't see the government make any improvements on that. They just keep talking on medications and vaccines, which has its importance. But like developing our personal immunity, it's much more important than that, and be resilient to severe infection and hospitalizations and decreasing the death rates. How much the exercise would be for that, it's underreported. So we should get more programs ruled by the governments to say, see, if you have a new pandemics or we have any other virus that comes, like you should be more strong to survive that than you were before, no? and really get more importance on the exercise, regular exercise, and not just medications. Like I think they never gave the proper attention on that. Yeah. Just like the US, I followed some American podcasts, and we see how much you guys struggle as well. So they do those mandates on some stuff, but they never mandate you to exercise, right? So
yeah, it's that continuum, right? Like how can we create a buffer against anything that life throws our way?
Yeah.
Well, we have just a few minutes left, so I want to finish with 3 questions I ask everyone at the end of the podcast. So the first one is, what are the 3 things that you do on a regular basis that have the biggest positive impact on your health?
I can start by saying that being a role model, showing people that what I do for myself, what I do for my family, regarding nutrition, regarding regular physical education, physical activity, doing CrossFit. I think being a role model is one. Being able to help people with their questions on a regular basis inside my office. I guess I could change the way we see the patients. Like I do spot therapy in the office. I even had a barbell. Inside the office. So, I had problems with my shoulder. So let's see how you perform. Let's see if you can identify what's preventing you to do in a better, reach better position where you can work, and how I refer you to people that really help you. So I think being a role model and teaching, inspiring my colleagues in medicine, and changing the way I do the physical examination in the office, I think it had the biggest impact on how I see sports medicine.
That's great. How about you, Rodrigo?
Yeah, it's similar with Bruno. I believe that to be an example is the most important thing as a doctor, to you inspire and change the life of our patients. And as I said in the beginning, CrossFit changed my life. And I think CrossFit is just a tool to do that. And it makes me to thinking about and eat health and practice exercise every day. As Bruno said, I have 2 child, and my boy has 12 years is 12 years old, and my baby girl she is 8, and both of them do CrossFit with me and my wife. And this example is the most important thing that I use in my medical office, in the ICU, and in myself, with my parents, my family, and my friends. I truly believe that to be an example and live what we say is the most important thing. And I use my example. I don't take any pills anymore. And this is why I said that CrossFit saved my life. And I try to spread this messaging with my friends and in social media with my profile on Instagram.
That's great. We'll do the last two questions here. One is, what's one thing that you're working on right now that you think would have an impact on your health? And then what does a healthy life look like to you? Bruno, you want to go for it?
Hi, Bruno.
I'm working on improving my nutrition is one of them. Having more family time and friends time is one more. We had some times in our life which we have to, as a professional and head of a family, to work a little bit more. So I'm working on getting more presence and improving my nutrition and focusing on being more consistent at the gym. And I hope to keep making part of this the CrossFit Games Medical Team. I can wait to the next season. And I hope the pandemics makes our lives easier for now.